I will be Courtney's audience, and I will be videoing her. Thank you.
According to the CDC.gov, in 2018, CDC published a study in Clinical Infectious Diseases, which looked at the percent of the U.S. population who got sick from the flu virus by using 2 different methods and compared their findings. The findings both suggested that on average, about 8% of the U.S. population get sick each year, with a range between 3% to 11%, depending on the season. As a society, I think that it's very important that everybody knows everything that's kind of a need to know about the flu virus, because it is a very contagious disease that affects your respiratory system, and it can even lead to death. So I just think that it's very important that the population understands everything about the flu virus. I have been researching over this for weeks now, and by the end of my speech, you should be informed of the causes, effects, and prevention of the flu virus. Let's take a look at the causes. The virus is spread through droplets. So coughing and sneezing is a huge way that the droplets get passed through the air, and people standing close, if it gets in your eyes, your nose, your mouth, you can contract the flu virus. If you even just are talking to somebody with the flu virus, you can contract it that way, because even just breathing can spread the flu virus if it's somebody who is contagious. Another way is by touching a surface or an object that has the flu virus. If somebody has coughed or sneezed on their hand and then they touch the table or a phone, and then you touch it, and then you touch your eyes, your nose, your mouth, you can contract the flu virus that way. It's a least likely way for you to contract it, but it can still happen. The flu virus, if you get it, you are contagious roughly about a day or so before the symptoms appear, until about 5 days after. And children and people with weak immune systems can actually be contagious for longer. Effects. Now that we've taken a look at the causes, let's take a look at the effects of the flu virus. Effects can include fever of over 100.4. It can include nasal congestion, cough, sore throat, fatigue, headache, and even some more serious complications can occur, especially in children and adults of high risk. Can include asthma flare-ups, heart failure, bronchitis, pneumonia, and FamiliesFightingFlu.org even states that you can get multi-organ failure and sepsis. Now that we've seen the effects, let's take a look at prevention of the flu virus. According to the CDC, the most important way to prevent is getting a flu vaccination. The CDC states that you should get one every year. Children and adults, children ranging from 6 months and up, should get one every single year, and they recommend by the end of October. And another important way to prevent from getting the flu virus is just by staying home. You know, it could never hurt to be in the house, not around all the coughing and the sneezing and the people talking, and, you know, chancing touching something that has the flu virus, or you know, people breathing on you. You never know, and sometimes they might not even know that they have the flu virus. So it's always a good idea to just stay at home as much as possible to prevent. Another way is by wearing a mask. Wearing a mask prevents it. You know, if somebody coughs or sneezes, you have less chance with the droplets, you know, coming into your nose, mouth, eyes. It also doesn't hurt for the person who is contagious to wear a mask as well to prevent the spread of the germ. And also, the focusforhealth.org even states that opening your windows and airing out your environment for about 20 to 30 minutes can also help in the prevention of getting the flu virus. So you see that it's very important to be informed on the causes, the effects, and the prevention of the flu virus. Have you ever gotten a flu vaccine thinking that you weren't going to get the flu virus and you actually still got it? If so, you're not the only one. I actually had a coworker, you know, who had gotten the flu virus, you know, through the years, you know, quite a bit, and she never got the flu vaccine. She was a little skeptical. Finally, she gets it, and she still gets the flu virus. So she's wondering, why did I still get sick? It's actually because whenever you get the flu vaccine, and it's even said as well, if you've had the flu, you'll be less likely to get the flu virus. And that's true, but it has to be that strain. Whenever you get the flu vaccine or whatever strain of the virus that you had before, the antibodies will fight it off, getting that same strain. But if you actually get a different strain of the flu virus, you can still be susceptible to getting the flu virus anyways. So I hope that this has been very informative, and stay healthy.